Welcome again. Another little video here for you to see. A lot of people ask me, how does it work in a session? So wanted to show you an insight into this. Here's me bringing international basketball player Matt Tracy through what we call a top tier movement assessment. And this is like your movement diagnostics. So we're looking at different patterns of movement. Do they hurt? Do they not hurt? And this sends us down different tunnels, is this worth looking at, not worth looking at? What are the best exercises for you? What's your deficiency? Like having a vitamin deficiency, what's your movement deficiency? And let's not just throw loads of stuff at you. Let's be super specific. And this is one thing that I suppose I've been really well known for over the past 12 years is the detail in the assessment. This is just the top tier. If something's off, we break it into little patterns. Next video here is Rory. Rory has a back issue, so we're bringing him through more specific tests. This is a nerve tension test. Bring him through some orthopedic tests. Again, just trying to ascertain, so you may not have a back issue, but these are different, kind of giving an insight on how much we're going to check. Check the local area, check globally as well. So cause and effect, I suppose, what we're trying to highlight here. You'll see the session's pretty relaxed. Time to have a sip. Good bit of talking for session one. Really trying to get to know the person, get to know the ins and outs of what's going on with them, what they're experiencing. Wish the video was higher. There I am with a spine, talking to Rory about he has lumbar instability, so there's a little bit of movement in his lumbar spine. Classically, with back patients, they're never told this. It's not checked, and it's like basics. This should be checked. Bringing him into an exercise now, which we also use as an assessment. So this is really teaching him how to engage key muscles for him. Looking at, classic exercise here, the bird dog, but how to do it with super efficiency. You can see on that side, much weaker. So not just going, here's a bird dog, do that for this amount of repetitions. Let's find out what he can do, can't do, and just make it all a little bit more efficient for him. So that particular test is just trying to see if Rory switches on certain muscles, will they help support his spine better? Here I am bringing him through his rehab. There's a weakness in the glute on the painful symptomatic side. So we're looking at, can we strengthen that safely? Can we get a little bit more core engagement? Very specific to him. Then I'm bringing him through some core activation next. The right way, the wrong way, the more efficient way, and being super fussy and diligent with how he does that. The exercises are going to be way more like practicing a new skill rather than just banging out an exercise in a sloppy fashion. That won't suit. So everybody will have their own little nuances with that. That's what we're going to try cover. Bespoke, I believe, is the word. In the next video, this chap is demonstrating a manual muscle test. This is kind of weird if you've never had it done before, almost like voodoo, but it's neurology. So it's looking at the brain's communication with the muscle and vice versa. So in this video, he's talking about how we can use any muscle in the body to check any other body part. So he's actually using her shoulder muscles to check if there's a problem in her knee. And if you touch that problematic area, if the body and brain doesn't like it, the manual muscle test will go weak. Now, how's the knee connected to that arm or shoulder? They're all connected via the nerves and your spinal cord up to the brain. So you just follow the wires. In there, he's showing, look, if she touches her neck, she stays strong because there's no problem in her neck. So this just tells us that her knee is a key area. It doesn't tell us exactly what's wrong, but it starts to refine the testing for us. So we could just be a bit more pinpoint. I guess those manual muscle tests are far more the practitioner than the patient. They could be a little bit odd, but the best advice is to go with the flow.